I had a very elderly lady who had dementia and was frequently over the winter months in and out of hospital with quite severe chest infections and problems. And because of her dementia, every time she went into hospital, she would become very agitated and very distressed. And actually, the treatment in the hospital would make her better for a few weeks, but actually she would then deteriorate again. And each time she came out a little bit worse. We had a conversation with her family and with the carers of the home who knew her very well. They do the day-to-day care with patients and they get a sense of that patient's distress and level of distress. And together as a team, we came up with, actually, for this lady's best care, sending her to hospital each time she had a chest infection was not the right thing to do, because each time she was very distressed and she would come out a little bit better, but not altogether better. So we together wrote a plan that if she became unwell with a chest infection or a urinary infection, we would give her oral antibiotics if she could take them, and made the decision that if actually she didn't improve with those oral antibiotics, we weren't going to admit her to hospital. We were just going to keep her very comfortable in the room where she'd lived for the last 10 years in the care home, with the people around her that she knew. We also made a decision about resuscitation in the event of a cardiac or pulmonary arrest, so where her heart stops, so she stops breathing, and made a decision that if that was to happen, we wouldn't try to get her heart beating again or her breathing again. We put those documents in place in the care home, so the actual documents stayed with our patient in her care setting. But on our computer system, I made note that they were there in a very clear manner, and that could be seen by my colleagues in the practice, and also we sent a notification off to the ambulance service and the out-of-hours service to say this was what was wrong with this lady, this is the conversations that we've had, these are the documents that are in place. From the time we put them in place, which was March of that year, to the July, she was seen 5 times for a chest infection. 4 times by colleagues, not myself, but colleagues in the practice, and on one occasion by an out-of-hours doctor. Each time they made note that the decision documents were present and they give her antibiotics. Previously, what we'd seen happening was that this lady had been admitted to hospital. She recovered on 4 of those 5 times, and then on the last time, which is when one of my colleagues saw her, she didn't make a recovery. We reviewed her, had a discussion with the family, and made the decision to keep her very comfortable at home, and she passed away very peacefully in the care home where she'd been for a long time. The family afterwards went back to the care home and spoke with the manager there and said how pleased they'd been with the care for those preceding a few months, because their mum had not been distressed. She'd been very peaceful on all of those occasions, and when she died, they knew, the people that knew her well, were giving her care. They wanted to come back and scatter her ashes in the care home gardens, because that's where she'd been happiest for the last 10 years of her life, and indeed that's what happened. And to me, that was a really great example of delivering care that was right for that patient and that family at the right time in the right place.